Hi everyone. Hi everyone. I think we already have 5 minutes, so we can start. Herkese hoş geldiniz demek istiyorum. Bugün size Türkiye'de gerçekleştirilen gıda güvencesi ve beslenme araştırması ve uzaktan teknik desteğin çalışmaya katkısı adlı webinarımızı sunacağız.
Today we will be presenting you a nutrition and food security assessment in Turkey, adding value and remote technical support. Welcome all.
Biz bu çalışmayı Welthungerhilfe ve Global Nutrition Cluster'ın teknik desteğiyle yaptık.
This work has done by WHH with GNC technical support.
Global Nutrition Cluster'da İsveç Uluslararası Kalkınma Ajansı tarafından sponsor edilmiştir.
The main support of the research here is the German Foreign Office and the Swedish International Development Agency. We would like to thank them for making this research possible.
Bugünkü webinar gündemimiz Welthungerhilfe hakkında kısa bir bilgilendirmeden sonra Global Nutrition Cluster'da bir bilgilendirme yapacağız.
I would like to share the agenda with you.
Kontekste bakıp
Firstly, we will introduce Welthungerhilfe, abbreviation is WHH, and the context, and then the GNC Technical Alliance introduction will be made. After the assessment and overview of the project is discussed in the context of Turkey, we'll talk about how the technical strategy team contributed these objectives, key findings, and recommendations will be presented. Then there will be a Q&A. I'm Seda, I'm the head of the project and field head of the Mardin office, WHH Turkey. At the same time, I also do consulting for the strategical nutrition projects.
Thank you for kicking us off, Sita. I'd like to introduce myself. My name is Alexa Humphreys. I am the assessment advisor with the GNC Technical Alliance, specifically the technical support team of the Alliance, and based in Portugal. Happy to be joining you today. Over to you, Çiğdem.
Thank you so much, Alexa. Herkese merhaba, ben Çiğdem İlçi.
Hi everyone, I'm Çiğdem. I'm a dietary advisor. I've been working for Welthungerhilfe for 2 years now for the dietary introductions. I will be sharing, and I will lead Alexandra.
Thank you, Çiğdem. Hi everybody, I'm Alexandra. I've been part of the monitoring and evaluation team at WHH Turkey for about a year. Hi.
Hi everyone, I think you can see and hear me. Yeah, they cannot hear me. Yeah. I'm Zeynep. Yeah, I'm the project assistant of the Istanbul office for the WHH and hope you enjoy my interpretation.
Okay. Sanırım başlayabiliriz. Umarım keyifli bir webinar.
We can start. Hope you would enjoy our webinar. We are so excited and we would like to thank you to share our excitement. I will be briefing about Welthungerhilfe firstly. Welthungerhilfe is one of the largest non-profit NGOs in Germany with no political or religious affiliation. Founded in 2002 under the umbrella of the UN Food and Agricultural Organization. They provided 3.5 billion euros funds in 70 countries over 9,000 overseas projects. Vision of WHH is dedicate itself to fight for a world with zero hunger, where people can exercise their right to a self-determined life in a dignity, justice, free of hunger and poverty. The vision is also compatible with goals of the United Nations Sustainable Development, which are famine and hunger. We have focused projects and programs in this area. These projects and programs are nutrition and food security, agriculture and environment, water, sanitation and hygiene, humanitarian assistance, economic development, civil society and empowerment. When we look at the establishment of WHH in Turkey, WHH has been officially registered in 2013 and has offices in Istanbul, Antep, Mardin and Hatay. Our activities aim to improve the living conditions of Syrian and non-Syrian refugees as well as vulnerable host communities. Since 2013, WHH 100 million euros have provided funds by running more than 60 projects. When we make an overview of 2020, projects are currently being carried out in 3 countries, Syria, Lebanon, and through Turkey, Syria and Lebanon. There are 201 employees with citizens of more than 100 countries. A fund of 50 million euros is provided by 22 projects. 1 million people were reached directly and indirectly.
Over to Alexa.
Thank you, Sita. Thank you for introducing us to WHH. Thank you, everyone who is joining us today. Again, my name is Alexa Humphreys, the Assessment Advisor with the GNC Technical Alliance. I'm briefly going to take us through an introduction to the GNC Technical Alliance, also known as the Alliance, to explain what we do, how and how other nutrition actors can access our support. Next slide, please. First thing, what is the Alliance? Well, it is an initiative that was launched last year, in 2020, in an effort to provide better support to nutrition practitioners in the field. Our aim is to improve the quality of nutrition throughout the cycle of preparedness, response, and recovery by providing technical support through numerous channels and also on numerous topics. Next slide, please. We have kind of 5 key modalities for providing this support. Sometimes practitioners will come with us looking for what is the most relevant guidance on a topic or specific resources, and we are poised to be able to provide those. Sometimes it's just a specific technical question they would like answered quite quickly, and we are here for that as well. Sometimes more in-depth support is requested. So in this case, we can assign a dedicated technical advisor. This can be someone that provides support either remotely, as we're going to see an example of today in this webinar, or we can also provide in-country support. Sometimes it's both. And we also have a vetted roster of technical consultants that we can refer you to when needed. There's also cases where we really need to swiftly develop interim guidance due to an emerging nutrition issue. And a good example of this is when COVID-19, when the pandemic started, there was a need to adapt a lot of things, and we were able to produce some interim guidance and briefs on this topic. Lastly, we are very invested in capturing lessons learned through the support that we provide. So we'd like to produce learning products such as articles, podcasts, webinars, things that other practitioners can learn from. Next slide, please. We can and have provided technical support on a wide range of topics, ranging from CMEP, IYCF, and nutrition assessments. Next slide, please. We've also looked at more specific topics such as adolescent nutrition. We've supported with micronutrient programming, for example. So there's quite a scope of what we can provide technical guidance on. Next slide, please. Now, the Alliance itself, it is a joint effort from many organizations who provide resources and capacities that we can leverage to swiftly provide support to you. However, there is kind of a key team that provides support on behalf of the Alliance, and this is known as the Technical Support Team. Thanks, Andy. Wrapping up soon. The technical support team, as you can see here, these are all of our lovely faces. We are currently 20 individuals who work in roles of coordination, as help desks, and as deployable technical advisors. Next slide, please. Once again, the Alliance is here to support all nutrition practitioners. So if you're interested, if you'd like more information, please go to our website, ta.nutritioncluster.net. And then you can just click on the orange request support button on the upper right-hand side of the screen if you have any questions or inquiries for us. That's all from my side. Over to you, Sita.
Thank you, Alexa. I think we have better information about the GNC now. Ben Türkiye'deki biraz genel durumdan bahsetmek istiyorum.
I will talk about the general situation and the context in the Turkey, and we will continue with our introductions.
2021 itibariyle
As of March 2021, the internal conflict in Syria, forcing millions to seek safety in neighboring countries, had entered its 11th year. And with this, Turkey remains the main host country receiving Syrian refugees. According to 2021 data of UNHCR, with over 2,007 million Syrian nationals residing within Turkey's borders, the closest country is Colombia with 1.7 million.
Türkiye Cumhuriyeti bu Suriye krizinde müdahalede liderliği üstlendi ve 2014 yılında bir geçici koruma rejimi uygulamaya konuldu.
In 2014, Turkish government acknowledged the protectorate nature of the crisis and has taken full leadership. In 2014, again, there was an access granted to basic services by a temporary protection regime in Turkey. And in 2016, the European Union, in partnership with the Turkish government, launched the SSN to assist vulnerable refugees and asylum seekers in Turkey. Of course, we still encounter with problems even with the sport, especially in southeastern provinces of Turkey. These problems are gaps in basic services, including protection, lack of access to regular income opportunities, lower wages and poorer working conditions, high cost of living, reduced purchasing power and poor accommodation, stressed food security, nutrition and health status, and also rise in employment and increased risk of poverty as a consequence of COVID-19 is the main points.
Türkiye'nin güneydoğu illerinde ikamet ediyor. İstanbul'dan
As you know, the majority of Syrians reside in the southeastern provinces of Turkey. As you can see, Antep, Gaziantep and Hatay, with over 400,000 population, leads this situation. So we conducted this assessment here. I'm passing to Alexandria. Thank you.
Thank you. Okay, hi everyone. So I will be giving a little brief overview of the assessment. Next slide, please, Andy. Okay, So the assessment was led by WHH, and we partnered with Crestpoint, which is an international research company, to conduct the assessment, well, the fieldwork mainly. And we were very lucky to be supported by the Global Nutrition Cluster Technical Alliance and the wonderful Alexa. So the assessment, we conducted it quite recently. So it's just been about 5 months. It was conducted in February. And as Seda mentioned, we conducted it in Gaziantep and Hatay, which are 2 provinces along the Syrian border. And there are close to about 1 million Syrians in both provinces in total. And we were able to conduct the assessment with 1,873 Syrian and Turkish households, which was in line with our sample size calculations. And there was around a 50-50 split between Syrian and Turkish households. Next slide, please. So why did we conduct this assessment? Our primary objective was to basically analyze the food security status and the nutrition practices of Syrian and Turkish families, mainly to assess their needs in these areas. Next slide, please. Okay, thank you. And looking at our other more specific objectives, we also wanted to draw comparisons between the 2 communities regarding their food security and nutrition needs. And we wanted to determine their ability to meet their food needs with assistance, cash assistance. And we also wanted to be able to analyze their household dietary habits and food diversity consumption. Next slide, please. Another key component of this assessment was IYCF, infant and young child feeding and maternal nutrition practices. So we also conducted an IYCF survey with 385 Syrian and Turkish caregivers, mainly because we wanted to also assess these practices for both communities. It was another main objective for us. Another one of our objectives was to determine the gaps in the areas of nutrition and food security and to be able to suggest interventions for both communities. And finally, we wanted to produce baseline data for future programming in Turkey, since there really aren't that many recent studies in these areas for both communities. Next slide, please. Thank you. So now to talk about the design of the study a little bit, we used qualitative and quantitative methods. So first off, a comprehensive IYCF and food security survey was designed, and we followed the most recent guidelines. So UNHCR's SENS, the WFP, UNICEF, WHO guidelines. Okay, Andy, I'm wrapping it up. And for sampling, we applied a 2-cluster sampling method and used ENA just to select 112 neighborhoods in Antep and Hatay. Then we used COBO, they were coded into COBO Toolbox, and 24 enumerators conducted the assessment door to door. And they reached over 3,600 households, but only 1,873 accepted to be surveyed. And then key informant interviews were conducted for qualitative data collection with nutrition specialists, academics, INGO and NGO staff, members of Food Security and Livelihoods Working Cluster. So that's basically how we did it, short story of how we conducted the assessment. Thank you, and over to Alexa to talk about the invaluable contributions she made during the entire process. Thanks.
Thank you, Alexandra. You were too kind, and thank you for that wonderful overview. I know this is a very complex assessment. We could have talked much more about the implementation, but in the interest of time, I'm now going to walk us through just very practically how I, as the assessment technical advisor, how I was able to contribute to the objectives of this assessment, even though I was providing remote support. Next slide, please. Now, there were essentially 4 key areas that I provided support to for the assessment. There was in the initial planning stage. There was in the development of data collection tools. I also was very engaged monitoring incoming data during data collection. And then I supported on the data analysis piece as well. Next slide, please. Now, when I was first brought on to support with this assessment for WHH and to support on the planning, one of the first things I did was to organize and lead some capacity strengthening calls to really look at and explore sample size calculation. Something to note for this assessment, it was quite complex because not only were we setting out to assess a population, we wanted to assess both Syrian and Turkish households, which are present in different proportions. We also wanted to assess mothers with children under 2. And you have different average household size for Syrian and Turkish households and different proportions of children under 2. So all of these we had to think through when we were thinking through our sampling strategy, our approach. Then I also led collaborative calls with the WHH team, as well as the research company that we were working with. So we could really, foster consensus and decision-making around the sampling approach. And then based on the outcome of these calls, also to support planning, I developed the survey protocol for the assessment. So taking all those ideas and concepts we decided on, I put them together as the survey protocol. And this survey protocol was then drawn on for the methodology section of the final report. Next slide, please. In terms of the development of tools, I did support in the development of the questionnaire. This was contributing to conversations about what indicators we should prioritize, sourcing relevant guidance, helping to structure some of the questions. And then finally, the electronic questionnaire itself was developed by the research company, but I then went in and I tested the questionnaire and I gave some feedback for how to strengthen the coding. Next slide, please. Once the data collection began, I was then receiving data on a daily basis. I was reviewing it closely for quality. I was sending feedback daily to the field coordinator to convey areas of improvement to the field teams. And also during this period, I was also closely monitoring to ensure that we were achieving our desired sample sizes for both Syrian and Turkish households and children. Next slide, please. For the data analysis piece, for this assessment, there was a lot of data. There were many indicators, as you're going to see in the next presentation. So to ensure a high quality data analysis when you're handling that much data, I actually supported, because we had a member of the research company that ran the initial analysis. I then reran most of the analysis using a separate statistical program, so we could identify and address any inconsistencies in the analysis. I then, at a certain stage, led some collaborative calls to ensure that between our WHH team and the research team, that we had harmonized the ways that we were presenting the data, that we were happy with how we were presenting the data in terms of the visuals and the tables, and that we were really telling the story we wanted to tell with the data. And then lastly, for data analysis, once all of that work was integrated into the final report, I did review all of the data in the final report, everything in the tables and visuals, to ensure everything was consistently transferred. Next slide, please. Now, clearly, not all aspects of implementing an assessment can be done remotely. And I just wanted to briefly go through some of the limitations of providing remote support to an assessment in this case. So for example, recruiting and training the survey teams. Normally, if you're deployed and you're leading an assessment, you're going to be heavily engaged in that. In this case, I was not. One, because I was not there, and second, because of language barriers. So this was fully led by the research team and WHH with the support of the research team. Supervision of data collection. If I was in country, I probably would have been very involved in that. As I was not, that was just the reality of remote support. So that was relied on for others to be supervising the teams in the field. Recommendations from the findings. I didn't support so much on developing the recommendations because we have great capacity with WHH, knowing the context, knowing their programs. So I was less involved with that. It just wasn't part of my TOR, but not that it couldn't be, just in this case it was not. And then for final decision making, I would say it's one thing to be deployed as a technical advisor to be the one leading the assessment. In this case, I was really providing additional support, so I was not a final decision maker, but that's fine. That was the request for the support. Next slide, please. So thank you so much. That was just an overview of the kind of support we were able to provide remotely to the WHH assessment. And I will hand over now for Çiğdem to present these exciting results.
Thank you so much, Alexa. Herkese tekrar merhabalar.
Hello again, everyone. Like I mentioned before, in this part of our webinar, I will be talking about the key fundings that we obtained, especially regarding the food security, maternal nutrition, infant and young child feeding findings will be shared. In our study, we obtained key findings regarding to food security, maternal nutrition, and infant and young child feeding. If we may start with the food security, we asked to those who participated in the study if their basic needs are met or not. We observed that 64% of Syrian and 38% of Turkish households cannot meet their basic needs, and 53% of the Syrian and 64% of the Turkish households cannot meet their basic food needs. 42% of Syrian and 73% of the Turkish households of respondents stated that the households did not receive any kind of assistance. This assistance includes food, voucher, cash, or fuel assistance. When we look at the unmet basic needs, it shows that among Turkish households, it is rent and food recited as unmet basic needs. For Syrian households, there was an inability to meet the needs of rent and food. So it was the same. After this, among the participants in the study, those who received the cash assistance were asked what they spent this cash on. As a result, it turns out that 92% of the Syrian households spent the assistance on rent, and 76% of Turkish households spent the assistance on food. Both for Syrian and Turkish households have been practicing negative coping strategies. To give an example for these, to gain money conducting risky businesses, selling the provided assistance for other people, or blocking the negative, working, making children under 16 working, she added. And then we have a reduced coping strategy index. It is more initiated with the households and their obtaining food. To give an example that they consume more cheaper foods, or reducing the number of meals eaten, limited portion sizes at meal times are the examples for these strategies. And then these are categorized as minimal stress and urgent. Syrian households that reach stress level is 11% and the Turkish was 13%. When we take a look at the similar dietary practices in Syrian and Turkish households, we see that they have similar dietary practices for 15 and 18 food subgroups that is presented in the slide. Turkish households consume these foods more frequently than Syrian households. It was asked the period for consuming these food groups on the table, and as a result, cereal food group was most frequently consumed among Syrians for both Syrians and Turkish households in the past 7 days. All of them were consuming the cereal group past in 7 days. For both communities, foods rich in vitamin A, seafood, and organ meats lesser consumed food groups among both households. Increased consumption for higher income levels was observed for legumes, vegetables, fruits, meats, and fish, and egg and dairy food groups in both communities. There is a system called food consumption score, which measures households' dietary diversity and nutrient intake. The food groups we saw on the previous slide is collected under 8 main categories. And the score is obtained this way. Based on this score, they're asked which food groups they consume in the past 7 days. And based on this score, a household's food consumption can be further classified into one of 3 categories, which are poor, borderline, and acceptable. And as you can see, there are 75% of Syrian households and 94% of Turkish households have acceptable score from this system. Now I will talk about maternal nutrition. In here, besides the maternal nutrition, we ask the mothers if they face difficulties in accessing health services, notice any informational materials from hospitals, in hospitals, or if they could use breastfeeding rooms. According to this, 32% of Syrian, 8% of Turkish respondents did not notice any informational materials. 37% of Syrians and 21% of Turkish respondents face difficulties in accessing health services. And 32% of the Syrian and 8% of the respondents stated that the health facilities they went did not have a private breastfeeding room. The most common challenges, one of the most common challenges is language barrier for Syrian women. And the other one is income problem. When we look at the C-section percentages, the 25% of Syrian mothers and 53% of Turkish mothers have C-section. In Turkey, in general, Turkey is one of the most highest countries that use a C-section. %53% of the Syrian mothers and 72% of Turkish mothers did not receive any support or counseling during pregnancy. They said if they could have help in this period, it would be helpful. For the dietary, maternal nutrition dietary thing. Sorry, I have a connection problem. Okay. A slight upward trend in increasing meal frequency with increasing income levels can be observed. Even the dietary. Sorry. Can you hear me? Can someone? Okay, thank you, Alexa. Now we're going to look at the IYCF key findings. We benefited from the indicators determined by the World Health Organization for children under age of 2. These indicators are initiating breastfeeding within 1 hour of birth, feeding the child by only breastfeeding in the first 6 months, and not giving any other liquid to the child for the first 3 days. And we try to point out these indicators in our study. To give an example, 51% of Syrian mothers and 54% of Turkish mothers reported initiating breastfeeding within first hour of birth. 42% of Syrian children and 24% of Turkish children were fed prolactally, meaning that giving something other than the mother milk. Among Syrian children, the most consumed liquid is water with sugar, and for Turkish children is baby food.
I think this one. Thank you. Suriyeli çocukların %6'sı ve
6% of Syrian children and 2% of Turkish children had never been breastfed. When we look at it generally in both groups, babies have received, have been breastfed in some point of their life. It is not a problem that these babies did not breastfeed at all. But what important is that babies should be fed by only breastfeeding in the first 6 months. And the other indicators that we suggested, they're wrong applications. So it's harmful for the child, even though they can be breastfed sometime later. For example, exclusive breastfeeding percentages during first 6 months is 40% of the Syrian infants and 53% of Turkish infants. Again, with the formula, baby food feeding is 39% of Syrian children and 26% of Turkish children. And the bottle feeding is 43% for the Syrian children and 49% of Turkish children. Here we look at the introduction of solid, semi-solid, and soft food to children between months 6 and 8. 64% for Syrian infants and 82% for Turkish children. When we look at the age for complementary feeding, starting of complementary feeding, it's 6.2 months for Syrian children and 5.8 months for Turkish children. It is said that it should be started, the complementary feeding should start after 6 months. There was similar results with the saying.
Çok ertelenmesi gibi, çok geç tamamlayıcı beslenmeye başlanması gibi durumlarla da karşılaşıyoruz.
Of course, we counter with the
Yaş Suriyeli çocuklarda 12. ay. Bu demek ki 12 ayda
situations like the starting of complementary feeding after 12 months or 8 months for Turkish children. We checked if they give any other food to the children for these.
Next slide, please. Ve bir de 6-23 aylık bebekler için minimum besin çeşitliliği sağlama koşulu var. Tamamlayıcı beslenmeyle. Burada minimum besin çeşitliliği sağlamak demek
To provide minimum
besin grubu
dietary diversity,
en az 4'ünü gün içerisinde bebeğin
there should be minimum 4 of the the 7 main food groups for the children.
olmasından önceki gün minimum besin çeşitliliğini sağladığı ortaya çıktı.
We observed that minimum dietary diversity is provided for these children.
Son olarak çalışmanın diğer bulgularına baktığımızda emir bakımından
When we take a look at the last results,
göre daha düşüktü.
consumption of iron-rich foods was lower among Syrian children than Turkish children.
Ve Türkiye'li çocukların %26'sı
The proportion of children who had consumed no fruits or vegetables the day prior to the survey was higher among Syrian children than Turkish children.
Türkiye'li gruplar arasında Türkiye'li çocuklara göre
More Syrian children than Turkish children had eaten any ASF.
sormak istiyorum.
And I'm concluding.
Teşekkür ediyorum.
I would like to thank you for listening to me,
Seda'yı bırakıyorum.
and I will pass this on.
Çiğdem, teşekkür ederiz. Bu kadar fazla bilgiyi sade bir şekilde bize aktardığın için.
I would like to say sorry for my problems with the interpretation. I have a really bad connection. This is me talking Zeynep, and I will interpret the Seda.
Bulguların üzerinden temel öneriler sunacağız.
We will present
Next slide, please.
some suggestions according to these findings.
Önerilerin başında
I'm interpreting Seda now.
farkındalık arttırma çalışmaları gelmekte.
Again, the most important thing is awareness raising activities.
Şu anda hali hazırda hem eğitimler ve seminerler düzenlemeye
As WHH, we are doing trainings and seminars on appropriate nutrition practices,
sadece kadınlara yönelik değil,
not just for women, but also for men and children. There should be trainings and seminars, and it should become more common.
özellikle yanlış uygulamalarda 2 yaş altı
Of course,
özellikle sadece annesi
there are wrong applications such as early breastfeeding, exclusive breastfeeding, timing of complementary feeding, dietary diversity among children under 2 years of
İkinci öneri,
age are one of the problems. This was the first recommendation.
bu araştırmada sorduğumuz sorulardan bir tanesi
One of the questions that we asked in this research
almadıydı hane halklarının.
is that if they take any advice on nutritional subjects,
Herhangi bir danışmanlık almadığını fark ettik. Ve
60% of Syrian and Turkish caregivers are not benefiting from any counseling services.
toplum burada bir hizmeti almaya hazır ama hizmet
Actually, the community is ready to receive the counseling, but there isn't many available counseling services, and people are not educated about if they can get receiving these counselings. So increasing the number of nutrition specialists and provision of counseling services through protocols between municipalities, migration health facilities, can be helpful for people to be educated about the counseling they can get. Also, adding nutrition experts to protection and case management teams in both INGOs and NGOs and provincial directorates of family labor and social services would be helpful for households to get more information about this. One of the questions was if they see any informational materials, if they notice them. Due to the gap in informational materials in Arabic and there was a problem. So we are suggesting that interpretation of this informational and educational materials so that it can be distributed through the public buildings and breastfeeding rooms. Another problem is breastfeeding rooms. Financial and staffing support could be given to local authorities to open such rooms to provide safe, private, and hygienic areas for lactating women. What we can do about this thing? We can support financially and in terms of staffing the migration offices and providing all the materials, we can support them.
Türkiye'de uygulanmayan başka bir beslenme aktivitesi aslında kadın destek grupları.
The other thing is women's support groups.
Karşılaştıkları sorunları paylaşabildikleri, özellikle diyetisyen veya bir uzman kontrolünde olan bir platform.
What are these women's support groups? These platforms are for women to get information about breastfeeding, other problems, and creating a support system within the women community to create a controlled platform for mothers to share their challenges and experiences. It would be really helpful. The other result was when we asked why could you not receive these information and these groups, they said the first challenge was language barrier again. We suggested that we can provide interpretation and translation services and transportation for these people. It is one of the most important slides because when we look at the findings, there's 64% of unmet basic needs within the Syrian community. Again, low minimum dietary diversity among Syrian children and low meal frequency among all mothers. And with the COVID-19 pandemic, it caused many people lose their jobs and vulnerable people have become more vulnerable. This is not just the findings, this is not just based on just this findings of this research. We can observe in all of the Turkey, and there are many other studies about this area. If we can make the awareness raising and income generating activities more common, then it is crucial to ensure people meet their basic needs and ensure food diversity. It can be improved in this way.
Next slide, please. Tabii Türkiye biliyorsunuz tarım ülkesi.
Of course, Turkey is an important part for agricultural.
Tarım ülkesi ve
Turkey.
faaliyetlere baktığımızda aslında en çok tarımla birleştirebiliyoruz bunu. Nedir?
we can generate income with agriculture. There can be a lot of activities in this area. We can increase poor dietary diversity among Syrian households if we can increase the activities with community and backyard gardening. It is 56 out of 105, the food consumption score. It could be caused by excess of, oh, sorry, I cannot hear again. Let me just. We can, okay.
Tabii ki bu alanda en önemli katkılardan bir tanesi yani beslenme alanındaki hizmetleri arttırmak için devlet ve sağlık kurumlarıyla koordinasyon gerçekten
Coordination with government and health actors are really important. It is crucial to expand services in nutrition. What we can do as NGOs are supporting health facilities with nutrition experts, providing translation services and IEC materials in Arabic language, providing transportation services. These are the final findings and suggestions of our part, and I'm passing to Alex. I'm so sorry, everyone. My connection is so bad. I hope you can hear me. I couldn't hear a lot of things.
So now we have our question and answer section after all of those lovely presentations and all that information. And so far we have 2 questions here, but if anybody would like to post more questions, please feel free to just post a question in the Q&A down below. You see 2 little speech bubbles. So perhaps we can start with Dildar Mehmet's questions. He's asked us 2 questions. So the first one is, why was there such a low acceptance to participate in the survey? Maybe Seda Hanım would like to answer, or anybody else. Seda Hanım, your microphone's off, by the way.
Evet. Okay. I will answer in English, right? Why there's such low acceptance rate? First of all, it is like the conditions are under the COVID-19 conditions. So because of the hygienic issues, nobody wants to enter. And one of the reasons, actually, the low acceptance rates is really high for the Turkish people. Why? It is because there is so many surveys are going on, and they really started to refuse, and there's a tendency against the Syrians sometimes, because they always think that okay, we are making surveys. There's a call. Okay. And they think that we are making these surveys and that we are giving the assistance to the Syrian families, so they sometimes refuse. So this is one of the reasons. But Alexa, do you want to add something as well?
Sure, just to add that, as Sita said, there was information coming from the field teams that some of the households were refusing. Quite a few were, but they were observing it tended to be Turkish households that were refusing to participate. And so it's just something we kept in mind. We were very clear in the limitation section of the report that we had these high non-response rates. it was likely more Turkish households. So we have to consider the fact that maybe some of the less vulnerable Turkish households were less likely to participate. So that was something we took very seriously, and we did discuss it in the limitations. But also just a note of caution that in the COVID-19 context with ongoing transmission, that could also contribute to quite high non-response rates. So that's that's all from my side.
Okay, thank you, Alexa and Seda. We have another question from Dildar Mehmet, and that is, how many nutrition projects have been conducted in Turkey, and are these sufficient?
I want to answer this question. Normally, Turkey is also there is a remote management for the Syria projects, and in Syria we have many nutrition projects are going on. However, unfortunately, in Turkey, WHH is the only one who have small component in the nutrition projects. So our dream, actually, our expectation, especially after this assessment, I hope these projects will be increased.
Hopefully. Okay, thank you. And thank you to Dildar Mehmet for both his questions. So next we have two questions from Gudrun Stallkamp. I hope I'm not mispronouncing anyone's name. And the first one is, did the Syrian or Turkish households receive any food assistance? And did that influence the dietary consumption? So we can start with that one maybe.
Okay, Çiğdem?
Yes, I can answer this question, but is it okay if I speak in Turkish? Okay, thank you so much. Burada aslında biz aktivite olarak beslenme açısından daha çok farkındalık arttırma çalışmaları yürütüyoruz.
Actually, we are doing activities based on awareness raising sessions with vulnerable beneficiaries, especially with pregnant women and people over 65. Like I said, we are mostly focusing on awareness raising sessions. We also provide food kits to those who in need. But of course, we have also IPA counseling for dietary consumptions. With the coordination of the case management team, we provide food kits to those who need after the evaluations. But we focus on mostly on awareness raising sessions.
Sada, are you going to add something, or?
There's a second question.
Yep, I'm going to read the second question now. Thank you for pointing it out. Another interesting question here is that, are there activities that you'd like to initiate to increase the consumption of animal source food? I think that stands for. You mentioned backyard gardening, but gardens only give us plant source foods, but ASF consumption was very low.
It's a really good question. Thank you, Gudrun. Actually, it is not our income generating activities not going to be include the gardening activities, but in the agriculture, we are also planning some poultry activities as well, like poultry farming. So it also, I think it is going to be add a value for the animal source foods.
Okay, thank you, Gudrun, for both your questions. And next we have a question from Beras, and he's asked whether we plan to deliver any response after conducting the survey.
Should I or? please go ahead if I miss something else. Thank you, Firas. One of the objective of this survey, because as you know, in Turkey, really there are really less nutrition projects, and according to this survey, what we expect, we just find funds, not only us, maybe other small organization can find from the organizations, from the big funds like UNICEF, UNSCR, and other source, and we already initiate together with the findings. We are just reaching out to major donors. I hope we can expand our nutrition activities according to the findings and recommendations of this assessment. Do you want to add something else, Alexa, Chidam? Okay.
Okay.
Very well said.
Alexa.
Oh, sorry.
Oh, sorry. Okay, thank you very much for that question. Next, we have Victoria. Thank you. She said great presentations and has asked, what were the biggest differences between Syrian and Turkish households you identified?
Chidam, do you want to go ahead first?
Of course, I can explain the nutrition part maybe, but for the other parts, if you add something else, I would appreciate. I'm really confused in which language I'm gonna talk. Sorry. Türkçe konuşayım. Aslında beslenme açısından sunumda
Actually, in terms of nutrition dietary, like I said in the slide, there are really similar dietary consumptions, but especially number of meals of the day are way more lower in the Syrian households. Other than that, the consumption of sugar is way higher in the Turkish household, Syrian household, sorry. Again, probably because of the income in Syrian households compared to Turkish household, there is lower consumption of fruits and vegetables. Maybe
aslında doğumdan sonra bebeklere anne sütü dışında herhangi bir şey verme oranları Türkiye'li annelere göre yine çok daha yüksekti.
Okay. After the birth, Syrian mothers gives way more food other than breastfeeding. Like the babies receive food other than breastfeeding in the Syrian households more than Turkish households. Again, C-section is way more common in Syrian households. There is nothing I can add other than that. If there's anything else, Seda, maybe you should add. Thank you for the question, everyone. You mentioned all of them, actually. Let me just continue in Turkish. She mentioned everything. In the food groups, out of 18, there's a common usage in the 15 groups of the food groups. Oh, she's talking so fast. There is a lot of difference between the spending of the cash assistance. Generally, Turkish households spends the money on the food and the Syrian household spends on the rent. In both sides, with the increase of income, the consumption of eggs, meat, fruits, and vegetables also increases. It is the same for the both households.
Okay, thank you, Çiğdem and Seda. Thank you for the question. Next we have, oh dear, Yute. I'm really sorry for mispronouncing. So we have a question, did you expect the results or were there any very surprising or shocking results?
Belki ben yine beslenme açısından söyleyebilirim.
Again, I would like to say something in the terms of dietary. Since December 2018, we are doing these activities. Activities.
Aktiviteleri gerçekleştirdiğimiz için aslında sürpriz, beklenmedik bir sonuç elde etmedik beslenme açısından.
There is no actually a surprising result in terms of dietary. We were aware of the situation and we were expected this. We didn't receive any surprising results for the Turkish or the Syrian households. It was all expected results. I would like to add something. Especially in terms of food security, we think that there wasn't any risks. We didn't have any food security projects because we saw Turkey as a high. We saw different scores for the food security for the Syrian households. We expected higher numbers for them, but in some households, it surprised us in terms of food security scores. Okay. Seeing that there is still giving sugary water, I mean water with sugar, giving this water to the babies was very surprising in the first 3 days instead of milk. I was done.
Alexa, is there anything you'd like to add? Oh, okay.
Yeah, just one thing to add. It was interesting. We didn't present it in these slides, but we did discuss, we did look at household composition, and it was just interesting to see that there were a larger proportion of female-headed households among Turkish households than Syrian. I would say generally we tend to equate more vulnerable populations to have more disrupted families and more female-headed households, but it was actually not the case with the results. And yeah, so I found that was interesting from a demographics perspective. But we did see, similar numbers of Turkish and Syrian households that had chronically ill household members and disabled household members. That was quite similar. And yes, sorry, that's the last I will say about demography, but the female-headed household percentage was significant, and it was something interesting in the findings. Over.
Thank you, Seda, Çiğdem, and Alexa. So there are 2 more questions here, but if anybody else would like to verbally pose a question, you can also just raise your hand. So I will just go ahead and read the question from Sonia. Thank you for the presentation. No worries. I wanted to ask about the choice of indicator for dietary diversity, which seemed to be FCS. While the FCS, the food consumption score, has been validated for adequate caloric intake and food security, as far as I'm aware, it hasn't been for individual dietary diversity. So is there evidence to indicate otherwise? Were MDD, WDDS, or IDDS measured? Thank you.
Alexa, do you want to go first for that?
Go for it. I have one resource I wanted to look up.
Okay, I can say for the food consumption score, we are not going for calorie intake. It is only about, we have food groups, and there are weights of these food groups, and we are just multiply this consumption with the weights, and it is not calorie intake. It is not about the calorie intake, so that we can measure it like that. And of course, for the dietary diversity, we also measure the MDD levels, which is really low for the Syrian children. I think Alexa is going to send the source, right? You are checking for the source.
Yeah, no, I was double checking. We did collect we did do the dietary diversity score at child level. At household, we actually collected indicators for both household diversity score as well as FCS. Yeah, and that was a collaborative decision that was taken as well with the research team. Yeah. But thank you for posing that question.
Yeah.
Agreed that FCS is more of a population level indicator and more speaks more to caloric intake than to dietary diversity.
Okay, thank you for the question and for the informative answers. We have another question from Gudrun, and it's given the support by the GNC Technical Alliance, do you think you could conduct the next survey with your own capacity or a data collection company?
Shida.
I think it's better if Alexa answered this question.
But we did wrong here, Gudrun. Thank you for the answer. I again switched to the English. Okay, everything. So we just take partially support from the Alexa. But what we can do next time, I think the partial support is not enough because we have really many problems with the research company in the field, actually in the data collection level. So this support should be really totally full support, and we really Alexa is really like a backup for us. As you know, in WHH, because we don't have a nutrition technical department, we are Chidem, Alex, and I. All of us have different roles in the organization. So we are just giving other efforts than in our normal job. So if we have a technical team, of course we can do it on our own. But if you don't have any technical team, if you don't have any nutrition department, and if you have different job titles, it is really hard to make this assessment without a support. And maybe it is like we are just presenting here 1.5 hours, but it takes our 10 months. It's really a challenging process for us, and we are really happy to finalize it. If there's a nutrition department, really Alexa can or GNC can support, and after the know-how came to the organization, they can continue. But if there is no nutrition department just dedicated to these issues, then you need again a support.
Okay, thank you for the question and also the answer. So that seems to be all the questions in the Q&A box, but does anyone have any other questions? I'm checking if anyone has raised their hands, but I don't see any. Any other questions you'd like to type or you'd like to verbalize? I guess that's the end of the Q&A session. I don't see any hands and no more questions popping up in the box. So thank you everyone for your questions.
10 dakika kala bitirdik öyleyse.
So we finalized it 10 minutes early. Like I mentioned before, it was a really hard process. We are working on this project for 10 months now. From preparing the questionnaires, planning the study design, doing the field work. And it was especially hard doing the field work in the condition of COVID-19. And of course, analyzing this complex data was really complicated and hard, but we're really happy to achieve this. And we like to thank you all. And I would like to individually thank everyone. These are the all I can add. If you have any questions, you can reach us through email. Thank you so much. Happy holidays.
Thank you, everyone.
There is something I'd like to add. There is a survey coming up just right now. It is really important for us, so if you can fill out the survey, that would be great. Thank you so much. I would like to thank everyone personally, as Zainab, by the way. Thank you all.